I feel as though they've included service users a lot more since I first was ill 4 or 5 years ago. The part that let it down was the actual hospitals itself, the unit that I was on, which at the time was very depressing, very lonely, not a very nice environment. But in the past couple of years, it's improved. I was very impressed with what the trust had actually moved forward, and obviously listened to what service users and carers wanted when people were going to be visited as well in the hospitals, by creating a family room, which is absolutely brilliant. It's improved my people skills. It's improved my social life, my well-being, my integration to society, and hopefully, you know, it's empowered me to live the life that I deserve, and I show a good example of how you can achieve things with the right help, because the hardest thing, I think, for people, if you're saying things, is actually getting them to listen. But I think the trust has actually done that. Well, they've listened to me anyway, I know that.
I think that the trust does well to engage carers and service users on the partnership boards.
The crisis team came out and were very helpful and responsive. The last episode was absolutely we couldn't fault the services we got.
Yeah, out of hospital facilities have improved a great deal. The way people get the care plans and things now has improved. More and more people are having access to the care plans than we did before, and people are being encouraged to take part in writing the care plans, which is a fantastic thing.
The things that the trust does absolutely well is trying to get people involved. I'm presently I've done some PEAT surveys, and I'm also the lead for the family rooms, and I'm just proud to be part of the whole service users involvement scheme.
What the trust is doing so far is brilliant, absolutely brilliant. I mean, it's come a long way in the last 10 years.
Well, the involvement scheme that Five Boroughs has started implementing with service users and carers, I think is an excellent idea, and I'm involved quite a lot myself.
It offers people training and employment opportunities.
I am very positive towards the management in how they have supported volunteers in terms of therapy and funding for the work which we do with the in-house patients, and I think that should continue and be expanded.
I want to thank the Five Boroughs for making Hollins Park more accessible. From a wheelchair user's point of view, it's brilliant. It's all modern, it's all ramped, electric doorways, doors that open at a push of a button.
And since the Five Boroughs Partnership Trust has come into being, I've found that mental health services have improved greatly. And also, I would hope that the Five Boroughs Partnership does strive to improve things all the time.
We're people with mental illnesses and we do have diagnoses, but by no means are we stupid.
Recently I've joined up to the Service User Involvement Scheme, which I do 1 or 2 days a week. I think this is very good. It gets people out and attending different meetings. Thank you.
One thing I think the Five Boroughs Partnership is very good at is it has a very big territory, and it serves 5 very different boroughs. They're very different geographically and in lots of other ways. And I think it spreads all its involvement activities and events very consistently. It spreads it throughout the whole territory, and it has a range of very different ways for people to get involved. So it's very thorough and has lots of opportunities for people.
Events like this you do well. You did a conference at the Foundry last week, well.
There's lots of interest now with helping people and it seems to be there's a link wherever you go. You can find the link to help you with your problem.